Hello everyone, today we'll be studying the procedural steps in the dental public health. There are total 7. We'll be studying it according to mnemonics, which is SAP of PA. So S means the survey, A means the analysis, P means program planning, and then the O means the program operation, F means financing, and PA means program appraisal. So it's SAP of PA. So let's begin. Survey. The survey basically focuses on towards the population rather than the individual. As it is said here, the focus of the attention of the survey is the population rather than the individual. Survey are the methods of collection of the data, their analysis and evaluating them in order to determine the amount of the disease problems in the community and also to identify the cases that has not been identified. The various parameters may be included for the assessment of the socioeconomic status of the community, nature of the distribution of the community, health problems of the community, and the resources available for eliminating the problems and the attitude of the community towards the health. Now next step is analysis. So after collection of the data, what we will do in the survey, we will do is analysis. So here the information collected through the survey is subjected to an analysis in order to define the characteristics of the specific health problems in the community. Then it is the data that we collected, it is necessary to be arranged or organize the data. Okay. By how will you organize or arrange the data? By the science of the statistics, which is applied to arrive at the common descriptive constants. So what are these statistics? They are like the mean, median and the mode and the standard deviation in order to achieve a correct diagnosis or to arrive at an adequate analysis. Now the next step is program planning. After analysis, we'll do program planning. The main objective of any public health professional is to have the design program that should be accepted by the community and that the people should show an interest in it. Here is the community that makes the decision of accepting or rejecting the program. It has to be ensured that the community is well informed about the program and they participate in all the steps involved. Okay, the next thing is next is program operation. This basically means that when a specific public health program has to be adopted for a community, a public health team which constitutes of the professionals in the various disciplines has to be employed for executing a program. Here one example has been given, that is the example of water fluoridation in a community with the high prevalence of the dental caries and the low level of the fluoride content in the their water supply. So to fluoridate the water, several disciplines have to work together as a team. First is the dentist that will have the responsibility of preparing the baseline data with regard to prevalence of the dental caries. The second is the engineers who will design the equipments needed for fluoridating the water supply. We have the chemist who will analyze the water samples, and for the water works department and the public health authorities will have the responsibility of addition of the fluoride in the water supply and the periodic maintenance of the same. Now financing. Now who will give the fund for all this stuff? The funds provided by the government, locals and the state authorities. Before starting of the public health program, the public health personnel have to identify the source of securing the funds. Many public health dental health programs have been conducted successfully through the financial aid provided by the local foundation and the local service clubs. The final is the program appraisal. This is the final step in the public health program where effectiveness of the program is assessed. The baseline data that was collected prior to introduction of the public health program serves as an indicator against which the effectiveness of the program can be assessed. The dimensions used for the program appraisal is appropriateness, adequacy, efficiency and side effects and etc. So this is all about